Yeah, thank you. Well, welcome everybody. It looks like we got a full room here, so that's exciting. I just wanted to start off by saying I appreciate you guys being willing to come out and be a part of this. I was a part of Team Ohio that's kind of been working to get all of this together, and so it's just really cool to see people, starting to buy in and listen to this and really see the impact that a fatality review can make in the community. And I just wanted to do a quick audience check. Who in here is a part of a suicide fatality review already? Okay. And then who is not part of one? Perfect. Okay. All right. So we have a wide range here, which is good because I'm going to speak a little bit about establishment of suicide fatality reviews, but I'm also going to talk a little bit about at the end talking about recruiting and things that can really help your process going forward and assessing who's at your table. So. First, I just wanted to introduce myself a little bit. So my name is Dallas Allen. I am the Suicide Investigations and Postvention Specialist at the Franklin County Coroner's Office. I received my bachelor's degree in criminal justice, and I graduated from Muskingum University in 2017. Since graduation, most of my career background has been in adolescent mental health. So I spent some time at a mental health residential for young women between the ages of 12 and 17. It was my job to help them with coping strategies that were needed due to lifelong trauma related to physical, emotional, and sexual abuse. I did that for a while. And then I actually went over to the Franklin County Juvenile Court, where I was a founding member of the Misdemeanor Services Program, which was a program where we were looking at low-risk but high-need youth, and it was our duty to divert them from further involvement with the criminal justice system. Regarding my current position, I am actually the first person to hold this title within a medical legal office in the nation. I can say, though, that I'm no longer the only. We have been working with a lot of different communities to have additional specialists within the coroner's office giving a unique perspective to suicide death investigations. And we actually have a new one here in Stark County in Ohio, so shout out to Stark County for jumping on board. That's really cool. So since July of 2021 when I started, I have completed hundreds of psychosocial interviews with friends and family who have lost someone to suicide. In addition to that, I've also provided over 700 individuals with grief guidance and resources that are intended to help individuals with life after a suicide loss. Although I'm a part forensic investigator and I help with the forensic investigation, I am a suicide loss survivor myself. And so above all else, an ultimate goal for me is to instill a glimmer of hope in the families and friends and everyone that I interact with on scene. So that number being over 700 of people that I've helped guide through this grief process is something that I hold very, very close to me. And it's one of my ultimate goals, and it's how I approach all of this from start to finish. And now I'll go ahead and talk a little bit about the objectives. I do want to say that there is going to be time after this presentation for questions and just have an ongoing conversation. We have a lot of different experience levels, people who are on suicide fatality reviews and individuals who are not on suicide fatality reviews and are looking to start the process. And so I would like to hear from everyone else and how they go about their process or have any questions about or comments of anything that I say today. So please, as I'm going through this, if you have questions, hold on to those, and we'll have an ongoing conversation after all of this. So I just want to give the overview. So first, we're going to go ahead and define the suicide fatality review and discuss how it can impact suicide prevention efforts. We will then go ahead and review how the Ohio Revised Code actually supports the suicide fatality review efforts in the state of Ohio. We're then going to go ahead and examine important roles as well as responsibilities of the Suicide Fatality Review Committee itself. And then lastly, I'm going to explore some key partner engagements for people who are just starting in the process. But then also I'm going to talk a little bit about recruiting that can be utilized for fatality reviews that are already in place, and it can help improve the quality of the recommendations that come out of those fatality review committees. Alrighty, so as we start this, I'm going to start just with the overall idea of fatality reviews as a whole. And then as I move forward, I'm actually going to focus a little bit more on the suicide fatality review specifically. So published literature has shown the importance of fatality reviews for revealing needs for new policies, prevention, and harm reduction. Currently, Ohio mandates the infant, child, traffic, and overdose fatality reviews, and currently has legislation in place, which I just mentioned, for the suicide fatality review. I do like to mention that the legislation for the suicide fatality is a legislation that allows us to have these take place, but it is not currently mandated in the state of Ohio. A couple initiatives that have been produced from overdose fatality reviews, as it's been going on longer in Franklin County. I just kind of want to show some things that have come through a fatality review process and have been implemented in our community. So some of those initiatives include the arrival of Project Dawn to Franklin County, which stands for Deaths Avoided with Naloxone. So this has led to all of our first responders in Franklin County having Narcan on deck, as well as additional agencies having those on in case someone is experiencing overdose, as well as we do a lot of programming to then produce free Narcan into the community so that people who are around people or struggle with addiction themselves can have those so that they can save their lives. Franklin County was also the first to incorporate REACT, which stands for Rapid Response Emergency Addiction Crisis Team. This is a collaboration effort between first responders, social workers, and treatment facilities to combat the ongoing opiate crisis. Individuals within this team will respond to the emergency departments in our local hospitals to interact with clients who had just experienced an overdose so that we can try to connect them with long-term services and help their path to recovery. Additionally, the HOPE Task Force was created within the Franklin County Sheriff's Office in 2016. This is a task force that treats all opiate overdose scenes as a crime scene. They are trying to determine who was the source of the drug that caused the overdose so that they can track them down and try to infiltrate the cartels and everyone who's providing those drugs on the street. In addition to those, the task force is going to collaborate with treatment providers so that they can help people with substance use disorders, connect them with treatment with the idea that we're trying to connect them with services and not just lock people up with addiction. I also want to say, and kind of preface this, since I'm from the coroner's office, a lot of what I talk about is from the perspective of a coroner's office. And I do want to mention that not all coroners have the time to spend on fatality reviews, which I believe really does bring up a strong need for system specialists like my position throughout the state so that we can add valuable information not otherwise obtained through the normal investigative system. The hope would be that we could have information gathered in other counties, shared and given to other communities so that we can actually get an overall state view of how suicide is affecting all of our communities, and so that we can kind of come together as a state and approach suicide the same way and make a statewide impact on suicide fatalities. Another idea that can come from the fact that sometimes coroners don't necessarily have the time to work on these. We can look at the idea of regional reviews as well. And as I go through this presentation, I'm going to talk a little bit about singular counties and how they approach suicide fatality review, but I'm also going to talk about how the legislation does allow for regional approaches into suicide fatality review as well. Alrighty, so what we're all here for, this is the suicide fatality review. So the documented purpose of the suicide fatality review is to decrease the incidence of preventable suicide deaths by promoting cooperation, collaboration, and communication between all groups and professions engaged in suicide prevention, education, or treatment efforts. As we've mentioned before, the SFR is backed by legislation, which is the Ohio House Bill 110, which grants agency the ability to share appropriate information with each other in a closed review setting. As I kind of did the audience check, we had a lot of people raise our hands that are new to this and haven't necessarily been on a suicide fatality review yet. And so I want to describe it a little bit. An SFR is a critical component of a public health approach to a community-based suicide prevention. That SFR is going to allow for communities to have a thorough understanding of the individual and community risk factors, warning signs, and protective factors that may be associated with suicide fatalities in their community. The data collected from this SFR process is extremely essential when it comes to planning, selecting, and implementing suicide prevention, early intervention, as well as those treatment efforts, which is documented in the purpose of the fatality review. Just describe what happens a little bit in a fatality review. So, suicide fatality reviews will be presented to the committee members. The level of detail involved in those case presentation is going to be determined by the community that is conducting those fatality reviews. Not every community is going to approach it the same way, and that is okay. We all can get to that end goal in our own way. For example, in Franklin County, which I am a little bit unique, as we were actually put in place prior to the legislation. So, we facilitate our fatality review through the coroner's office, which I am the only person that facilitates a fatality review through the coroner's office, because as the legislation came out, it made requirements on who that should be, what agency should be involved, their lead agency, and who should facilitate those meetings, which I will speak about a little bit here in a little bit. But so as I talked a little bit about in my bio, I complete those full psychosocial investigations. And during our review, I actually present those complete investigations to my committee members, giving details about the decedent and their life experiences so that we can have a clear picture of what that decedent was involved in, what their life experiences were, and what may have unfortunately led them down the path of harming themselves. And so this really kind of deep dive approach allows us to highlight some of the shortcomings that may have been missed in our community. Was there a lack of education? Did we need to increase certain resources? Did we need to make it easier for these individuals to be connected to those resources that are available in our community? But as I said, the way that we do it in Franklin County does not mean you have to do it that way either. I have worked and spoke with a lot of different communities who approach it a little bit differently. And so they'll actually, in their meeting, just report on the coroner's report that's obtained through the coroner's office. They will actually bring in the obituary so that they can actually learn about the individual and what they loved and what they did, as well as they will reach out to the other agencies that are on the committee so that they can bring their involvement to the meeting so that we can actually see if that individual was connected, where they were connected, and what services may work and what may have not worked for them, so that when we look at a future situation where a decedent may experience something that someone else is experiencing something extremely similar, right? And so that we can look at what didn't work with that, what can we improve, what can we do as a community to make suicide resources more accessible, more available to our community members. So that's just an idea that just that we do it one way in Franklin County doesn't mean you have to do it that way. I've seen it worked different ways with certain levels of information, and they still were able to come up with quality recommendations to prevent a similar situation from happening again. In Franklin County, as those cases are presented, we're then going to open the floor for that collaborative discussion, right? So the committee members are really, really important when it comes to a fatality review. And so looking at who's at the table and what they can bring and talk about, whether that be a lived experience or just knowledge from what they do in their day-to-day. We will go ahead and see what stuck out to all of the members that are on the committee. And then we're going to also talk a little bit about those recommendations, right? We're going to have everyone be a part of that. It's not just one person. It's not the facilitator who's coming up with the recommendations. It's important for everyone to have a voice on that committee, as everybody's coming from a different view. And that, I think, leads to the improved quality of those recommendations. For example, here in Franklin County, we have a lot of resources for people who are struggling with mental health and suicidal ideation specifically. But it's been historically hard to access them. It's hard to connect individuals to these services. And so the idea of the fatality review for suicide specifically is to make that gap smaller. What can we do as a community to make that access easier? Providing more free resources to the community, educating the community on what is available to them, making sure that we're looking at certain at-risk populations, different cultures that may not speak the language of an English language and might not know what is out there for them. And so it's about looking at the community as a whole to figure out what we can do to make that easier for everyone involved within mental health industry or suicide prevention in our community. For my last statement that I had just said to take place, that SFR requires that formation of the committee, which I mentioned. These members must be committed to a multidisciplinary and collaborative approach to analyzing suicide deaths. SFR committees collectively discuss and assess factors and circumstances contributing to suicide fatalities. The recommendations that are then created by this committee are tailored to make changes within local policy, systems, and environmental factors. It's important to note that the committees must be committed to having the discussions that are confidential, non-judgmental, and trauma-informed. That's a big one. We're talking about very intense and traumatic events, and so we need to make sure that our conversation at all times is very trauma-informed, and I'll speak a little bit more about that here in a little bit. So in an ideal situation, the committee members that are in attendance will then take those recommendations and all of the gathered information and implement those into their daily operation. But not only just implementing them into their own daily operations, they are expected to continue to educate other agencies and individuals about those recommendations that were created through that process. The idea is that if we have everyone a part of the committee that is doing work outside of the committee to educate the community, we're going to increase the surface area that we can actually connect when it comes to those recommendations and actually affecting the number of suicide fatalities that we see. All righty, now we're going to get into legislative talk. This is the fun part of all of this. So, as I mentioned before, the Suicide Fatality Review process is supported by House Bill 110 in the 134th General Assembly, which became effective in June of 2021. Additional provisions were then generally effective in September of 2021. In this legislation, the General Assembly authorized the creation of the Suicide Fatality Review Committees. The provisions that are listed in the legislation for the Suicide Fatality Review Committees are extremely similar to the legislation for the Overdose Fatality Review. Essentially, the provisions are the same for each, with just a couple differences that are more specific to each manner of death. Additionally, like I said, the SFR suggests that they are allowed to be conducted, but they are not mandated, such as other manners of death are. After the legislation went live in June of 2021, the Ohio Department of Health realized that they were actually mentioned in that legislation for reporting annually. So each fatality review has to report their recommendations up to the Ohio Department of Health. So at that time, the Ohio Department of Health actually took a look at the legislation and made changes for their involvement into that, and created reporting guidelines for the Fatality Review Committees, which you can actually find on their website. The guidelines describe what must be reported up to the Ohio Department of Health by April 1st of every year regarding the cases that have been reviewed, as well as each documented recommendation that came from each fatality review throughout that previous year. The legislation takes time to dive into the establishment of the SFR committee, the committee membership, who should be the chairperson for those committees, confidentiality and information security, cases that are still under investigation, as well as information requests. Then my last point on this slide is that requirements listed in House Bill 110 regarding the SFR process is always changing. Therefore, the legislation is designed to be a living document. And so committees are asked and encouraged to make sure that they're up to date on which version is new for the SFR, so that you know that you're still in compliance with that legislation and conducting your reviews the right way, depending on how the Ohio Revised Code mentions it. Alrighty, so now we're going to actually dive into some actual important committee roles. So the ORC has actually clear requirements within it that actually govern the establishment of the committee and these certain roles. So the first section on this slide is section 307.641 of the ORC, which includes 3 important sections that should be reviewed when you're establishing a committee. Section A actually discusses the establishment of a review by the county commissioners. Section B talks about the allowance of regional reviews, which I talked about a little bit ago. And then Section C is going to talk about allowing boards that actually predated the legislation to continue operations as they were. And so Franklin County, and I believe Montgomery County is the other one, those two that were actually established prior to that legislation. And so that is why we're still able to conduct our fatality reviews through the coroner's office and conduct them the way that we do, because we were actually predated to the legislation. I also wanted to point out that the ORC does permit hybrid models for overdose and suicide fatality reviews. So throughout my time actually facilitating these reviews, I have worked with numerous communities that have selected a hybrid approach compared to doing each manner of death isolated. The reason being their numbers of suicides might not be as high, their number of overdoses might not be as high, just due to being a rural community or whatever have affected that community for their numbers to be lower. And they felt that it was a better use of their time and resources to actually conduct those fatality reviews together. So in those reviews, they're actually going to be reviewing suicide deaths as well as overdose deaths, as there is a lot of overlap, and so it can be done that way and still come up with very good quality recommendations throughout that process. The next section of the ORC highlighted on this slide is section 307.642, which provides the required members of an SFR committee. In a single county SFR like Franklin County, the mandated agencies are the local chief of police or a county sheriff to the local county, a public health official, the executive director of a local ADAMH board, and a physician authorized under ORC Chapter 4731 to practice medicine. If the individuals that hold those titles cannot attend the meeting, they must delegate it to someone else to attend the meeting to represent their agency. If communities are conducting regional reviews, as I said, a legislation will talk about the differences. Nothing really changes there. The mandated agencies are still the same, but they're actually going to come from the most populated county within that region that is being reviewed. So when you're looking at the county sheriff, you're going to pull that from that most populated county within that region of cases that are being reviewed. Another note for this certain section that I like to mention and talk about and have people focus on when they're looking through the legislation is subsection B, which describes the role of the coroner and also inclusion of additional members. So the coroner of the operating county must be invited to be a part of the committee. So even after each election and there's a new coroner that takes office, each time that coroner must be invited to the review. Now, although that they must be invited to the review, they are not mandated to accept that invitation. If the coroner chooses to not be a part of the suicide fatality review, they are still mandated to provide the complete report of that decedent for the fatality review to review that. Examples of that full report can include the coroner's report, which I mentioned, the autopsy report, which was found during the things that were found during the exam by the pathologist, as well as the toxicology findings, so that you could see what was in the decedent's system. You can compare if they had alcohol issues or issues with other illicit substances. You can look at what their levels were at the time of death, and then that can kind of fuel a lot of conversation when you're talking about the overlap between mental health and substance use. And as I said, although it is not mandated for the coroner to be a part of the fatality review, it's extremely beneficial to have them. If you do have your coroner involved, or at least someone from the office that can actually provide information, you can actually have the opportunity to get specific information related to the decedent from the findings that were happening on scene, as well as a lot of times on scene, the investigators are interviewing next of kin, and they really can collect information related to that mental health, suicidal ideation, behavior changes leading up to the death, and you can really take a look at what could have possibly been done in that time leading up to their death as a community standpoint to better connect that person to resources, or if it was some other issue, that would be highlighted in that information, and we can work to increase our capacity to prevent similar situations from happening again. As I mentioned, that legislation is also going to allow for the addition of any other individual or agency that can provide beneficial discussion to the fatality review. these members can actually serve on the committee for a time established by the people who are already on the committee. So the agencies and individuals that are already a part of the committee can come together and say, is this someone that we just want here for this review specifically, or we would like to have them for the next couple because we're looking at individuals that may have been involved with their agency. It's really all depending on each of the fatality review and how they want to approach that. A couple examples on how we approach that in Franklin County, we try to add additional agencies or individuals every single review that could actually increase the conversation that we're having related to that at-risk population that we're speaking about. So for example, when we were reviewing older adults, we actually reached out to have our local office on aging to be a part of our fatality review so that they can discuss how they interact with their older adults, what their intake form looks like, and how they approach mental health and suicide in that community. This was actually really beneficial because as we brought them on and we were having a conversation with them, we actually discovered that they were not asking questions about mental health and suicide. It wasn't on their intake form. And they just didn't really necessarily think about it because they were looking into physical mobility issues and other physical health issues, which is important. But it's also really important to ask those questions about mental health and suicide so that we can identify people that are at risk and so that we connect them to services. Another agency that we use a lot sometimes is Kaleidoscope. They're an agency that looks into youth of the LGBTQIA plus community, and so they can actually provide lived experience as also education related to services that are available for individuals that are a part of that community. And then also a unique one for our counties, we actually were looking at cases where it was a suicide by firearm specifically. And so we actually reached out and had a gun store owner come and be a part of our fatality review to talk about how they approach the sale of firearms, what they would do if someone came in to buy a firearm and they were exhibiting red flags, and it seemed that they were going to be using that gun to either harm themselves or others. So throughout that conversation, we talked about the idea of increasing question, persuade, and refer trainings to all employees within those gun stores so that when they're speaking to someone who's trying to buy a firearm, they're able to have that conversation with them, see if there's any red flags, and then possibly lead that person to connections within resources and possibly even refuse that sale so that when they are in that moment, they're not able to have that lethal means in their hands, and then possibly with that extra time we just spared, we can connect them to services. And I also, before I go to the next slide, I do want to mention it's really, really important to have people on your review that have lived experience. A lot of times we can talk about how we would approach it if we were in that situation, or we can talk from an outside perspective looking in. But having people that have this lived experience can really improve the overall quality of those recommendations as they're really coming from a spot saying that, hey, this is who I am, this is very similar to me, this is the people that I work with because of my own experiences, and just their opinion and knowledge on the situation that's being reviewed is unmatched. And so I really, really strongly urge you when you're looking at these reviews to have people that have lived experience. Make sure that you have people who possibly have been experienced suicide loss in the past, so that they can actually inform that process a little bit more, trauma informed for people who may be experiencing that trauma now. Alrighty, and now I'm going to talk a little bit about chairperson versus the facilitator. So these are two very big important roles when it comes to the SFR. So there is a clear requirement within the Ohio Revised Code when it comes to who should be the chairperson of an SFR. The legislation describes that either the health commissioner themselves or a representative of the health commissioner must convene the meetings and be the chairperson for that review committee. Duties of the chairperson would most likely include planning the meetings to ensure their effectiveness, making sure that the meetings are in line with the listed legislation, and then ensuring that the matters within each meeting are dealt with in an orderly and efficient manner. When it comes to the facilitator, the chairperson actually can be both, or they could also delegate the duties of facilitator to a different individual or agency. If the chairperson does choose to delegate that, they may choose any agency or individual to be the lead agency. There is no necessarily any specific agency outside of that chairperson that can be the lead agency or facilitator. Again, Franklin County was predated to that, so that is why I am technically the chairperson and the facilitator, but with the new legislation, you would have to have that separately and would go through the health commissioner. The facilitator roles would most likely oversee the logistics, meeting facilitation, and recruitment. The facilitator would create a plan for case selection for the cases to be reviewed, ensure that each member is up to date on those cases and ready to bring their appropriate information to the meetings. Another important task of the facilitator is to keep the discussion on track within each meeting. It also is important for the facilitator to make sure that each committee member is free from individualized blame, that they're not in there just blaming someone that, we believe if they did this, this wouldn't happen. It's not necessarily that we're there to blame. We're just looking at what we can do better as a community and not there to blame individuals. And also I said the facilitator would then oversee membership. So creating that plan for recruitment. And I believe creating that plan for recruitment is extremely vital to assess who is at the table, what perspectives are being missing, so that we can utilize a recruitment process, bring people to the table that's only going to improve those quality recommendations. And then my last point on this slide is having someone on the committee that is trained in trauma-informed care, right? So I mentioned this a little bit earlier. Conducting these fatality reviews is extremely important work. It really does a lot in identifying factors that need to be altered within the community. But in the process, there is a strong risk for that secondary trauma. We're talking about very detailed events, and so we're being exposed to suicidality and mental health at a secondary level. And so it's important to bring self-care to the forefront when you're doing these fatality reviews. And so having someone on board that is trained in this trauma-informed care and can actually bring these ideas of self-care to the forefront. In our meetings, we've tried historically, and I will be honest, it's really hard to have the conversation related to self-care in these committees. You have a lot of people coming from different perspectives, a lot of different agencies, and so sometimes doing like chair yoga or things in your meeting can be pretty difficult, as you have people that are like, that is not my cup of tea. I'm not stretching in my chair. And so they're just looking at you very weirdly as you're doing all these crazy things in your chair. And so that can be a little bit difficult. But it's really important to still bring that to the forefront. It might even be just a discussion on, hey, what are you doing this weekend? Make sure you get outside. I'm doing this. Make sure that you're taking care of yourself, just as a reminder, because a lot of times you can get lost in this work and not necessarily look at yourself. I always say you can't pour into a glass if yours is empty, right? And so it's really important to take care of yourself so that you can still do this work. Alrighty, the implementation phase. So you've heard me talk about the quality of the recommendations quite a bit at this point throughout the presentation. And so now I want to talk a little bit about the implementation of those recommendations. So I threw an underline and a bold on this first point on this slide because it's extremely vital to the success of the SFR. The conversation being had within an SFR is empowering. It's really powerful conversation. But until we actually have the ongoing implementation of the recommendations that are being created, it's just that. It's a conversation. We're talking about the issues that are prevalent in our community, but what are we doing to actually create actionable change and change those issues that are in our community? Effective suicide fatality review committees rely on the active participation and dedication of their members, which I talked a little bit about already. Those members must be prepared to take the gathered information and the recommendations outside of that review, not the case information, right? We can't bring out any details related to the decedent and their family, but bringing out those recommendations is the overall idea of this. And so that active participation from the members is extremely important. They must be willing to take that and implement it into the daily operations, but then also expand that surface area that our recommendations are being touched, right? So educating other individuals. When you're having meetings and you're having a meeting with an agency in which a recommendation can actually be really important for them, make sure that you're educating them on that. They might not have been a part of the process. They don't know about it. And so if we can continue to educate them, we're only going to expand that surface area. Suicide is a complex issue, which I'm sure everyone in this room knows, right? And so addressing it alone is impossible. And so when you see this type of information sharing and we're getting out of those silos that we all work on and we're bringing all these people together to have these conversations, it's at that point that we believe that we're going to create that united front necessary to tackle this issue that is prevalent in all of our communities. In addition to having your members be actively participating in the implementation of those recommendations, another way to aid in that implementation process is utilizing a local suicide prevention coalition. Shout out to Jess, shout out to Angela, and all the people that work with me on our local coalition. So in Franklin County, we've actually positioned our local suicide prevention coalition as the actionable arm for our SFR committee. What that means is they actually act as a subcommittee to our SFR and work together to actually help the community regarding that established recommendations. So our coalition has 3 action teams a part of it. That's going to be education, communication, and data and research. As the facilitator for the SFR in Franklin County, I also sit on the data and research action team, which is a part of the coalition, and that's actually where I would take all of our recommendations that we gathered and I report them to our data research team, in which then we work together to categorize those recommendations using a social ecological model so that we can make them more digestible and actionable to when we then reach out to those stakeholders and people that those recommendations can impact. We are currently, this is still a work in progress. This is something that we established after we were already doing this, and so we're still in the process of making this work, and we're in the process of categorizing all of our recommendations. We're up to, hundreds and hundreds of recommendations at this point, and so it's going to take some time for us to get them all categorized. But our next step in what we're doing is actually trying to establish a way to track the success of those recommendations. So track who those recommendations were given to, and then actually try to track the success rate of those. So what was our suicide numbers before we then went ahead and implemented these recommendations? And then the hope is that we go down, right, and we can actually track that success rate and then use that information to then increase more buy-in, see that these recommendations are impacting the suicide fatalities that are in our community. And so at that time, we feel that we're then going to continue to make an even bigger impact with those fatalities. My last point on this slide, which I talked a little bit about already, is the annual reporting. So this is what needs to be done to the Ohio Department of Health each year by April 1st. And then it's important to make sure that you look at ODH's website because they do have guidelines of what they would like to be reported to them. So essentially each year the active committees generate a report that highlights the cases that were reviewed throughout the year and report each recommendation created by that committee. The Ohio Department of Health plans to be able to then get a broad overview of the recommendations from a state view and then work to then trickle down those recommendations into the appropriate community agencies. And so this is just another way to increase the implementation of those recommendations. And before I leave this slide, I do want to give a small shout out. The picture on here is actually a picture from our all coalition meeting. And so these were members from all of our from all of our action teams within the coalition. And so we actually had members from each team come together, discuss what each team is working on so that we can actually get an overview of what the team as a whole is doing. And so I actually presented there and told them a little bit about the recommendations as well. And so we can just get more and more people on board. Being a part of the coalition is something that I can't really say enough about. It brings together many different perspectives and expertise and just knowledge from all over the place, from mental health providers to peer specialists to lost survivors to people who can really just give you information and just educate you. I mean, even doing this work, like you kind of get lost in doing your own thing, but when you get into a group like this and have conversations with people, you can really see that there's so many people that are doing this hard work. And when you can bring all of them together, we believe that it's truly going to impact our community for the better. Alrighty, so in my final couple slides, like I said in the objectives, I'm going to talk a little bit about partner engagement as well as recruiting. So the key partner engagement plan, this is probably something more for committees that aren't necessarily established yet. You're just trying to look at what is next steps, who you're going to look at to be a part of your board, and what level is their collaboration for your fatality review going to be. When we were attempting to build our fatality review in Franklin County, we relied heavily on this key partner engagement plan. Utilizing this key partner engagement plan will help you organize the process of connecting with a potential partner for that fatality review process. The plan will start out by having you label the level of potential engagement. The different levels include co-create, collaborate, involve, consult, or inform. After you place your potential partners in those respective levels, the plan is then going to have you list potential barriers that may make it difficult for that potential partner to commit to the fatality review. Here in Franklin County, listing the potential barriers made it extremely easy for us or me to then plan on how I'm going to approach that partner. I'm already expecting that pushback so that when it does come, I'm able to navigate around those barriers and say, okay, I knew this was coming, but I want to say, you know, this, we can do this, we can try this, and we can work around that and make this work for both of us. In addition to the barriers, the plan is also going to have you list enablers. And so these are going to be things that you can actually utilize to entice that partner to be a part of the committee. Examples of those enablers could be establishing how that potential partner could benefit from the participation of the review. So not only just is the community going to benefit, but how is that agency specifically going to benefit by being a part of that committee? And when they actually see that there is potential benefit, rather that be connections of people who are already on the review or those recommendations actually affecting them personally, they might be more apt to be on board. After listing those possible barriers and enablers, you can now detail the logistics on how you're going to actually reach out to that potential partner. These activities could include asking for one-on-one meetings or even just setting up a phone call with those partners. Me personally, when I was actually doing this key partner engagement plan and trying to look at who was on board, I actually created a small PowerPoint slide in which I talked about the purpose of the Suicide Fatality Review, talked a little bit about some recommendations that have already been created, and I've received some pretty positive feedback from that as they were able to see, okay, so other people are already doing this, you know, it's working, and I've just received more positive outlooks on that, and I've received a lot more people saying yes to me and being a part of my committee just because of that little PowerPoint that I was able to show them. Early in the presentation, I was speaking about that implementation phase. I mentioned that our local suicide prevention coalition can help with the recommendations and all of that. And so engaging them on our fatality review is a really important way that the key partner engagement plan worked. And so in that process, I was looking at them to be an actual collaborator for our fatality review, be a part of the process when it comes to that implementation. So we weren't just necessarily, informing them. We wanted them to actually be a part of the work and help us increase the surface area of the. And so by identifying them as a collaborator and then having them on board, we've actually seen more increase in people wanting to be on board because I can actually utilize the coalition as an enabler, because we can talk about how they actually have a lot of different perspectives. They can actually help with free resources. We've talked about expanding the number of free lockboxes that we give to the community. There's additional funding streams that can come out throughout this committee because we have the coalition on board. And so that was just a process that we started. We got them as a collaborator, and then now I can use the coalition as an enabler when I'm talking to potential partners. So that's how that key partner engagement plan can work out. Alrighty, and then last thing, I'll talk a little bit about the ongoing recruiting. So this is, like I said, for those established review committees that are already in place and doing this work. I believe this is a very important process to look at what gaps exist on your committee, who is missing from the table, and how can I reach out to them to get them a part of this table. I do want to say it's also really important to have the committee themselves be a part of this process as well. Not just a facilitator thinking about what's missing. Ask your team, who do they think is being missed at the table? They might have an idea that you didn't even think about, and it can really improve the overall process. And so I rely heavily on that. Just in our last review meeting we had, I talked a little bit about self-care, and then I said, hey, you know, we've had some turnover a little bit. People go to different places, and they don't have the time to be a part of the committee. And what can we do to improve that? We now have a couple little gaps of people that have left that are doing other things. And I had just emails flood in after that meeting. Oh, I think this would be important. I think this could be cool. And I now had a list of people that I could reach out to. And I've actually engaged most of them and have gotten success with a lot of them. And we've filled those gaps with just in a couple days. And so engaging your team and having them be a part of it and not just feel that they're a part, you know, just on the committee, actually being a part of that is actually going to make them feel better about the work that they're doing and the impact that they're making on the community. When vetting new members for the Fatality Review Committee, it's extremely important to clearly outline the expectations for those members. A good way to outline those expectations is through a recruitment letter. There are many examples out there to help you create a recruitment letter. You don't necessarily have to the wheel. There are examples out there. The review manual that everyone got to start this as well, there's an example of a recruitment letter in the appendices of that review that could be utilized to tailor it towards your community. That's just an example. It doesn't have to be the terminology that's used in that. That's just one way that it can work. And of course, you can move that around to fit your community better. After sending out the recruiting letter, it should be the facilitator's duty to contact the potential member and set up that meeting. In my experience, when I'm reaching out to a new member, I actually take these as if it was like a job interview. I'm actually interviewing that individual so I can learn more about that individual, learn about the agency that they represent, so that I can have a really good understanding of what their potential impact would be once they're on the Fatality Review. But also, this work is not necessarily for everyone. It's very difficult work, and hearing these details just might not be their cup of tea, and that's fine. And so make sure that you're clearly outlining these expectations, they can then make that educated decision that this is something that they still want to be a part of, or would they rather work in the field or in the space in a different capacity where they can possibly be less exposed to that secondary trauma, but still impact suicide in our community. And so I've just found it really beneficial when I conduct it as an interview so I can have that conversation, and then we're all on the same page and that they know what to expect if they sign up. I don't want people to come to the first meeting not knowing this and then just be blindsided by the information being shared, and then now, you know, I feel that I've just traumatized that person because I didn't have that conversation with them. Presenting the purpose of the review for a new potential member can also be extremely beneficial. Giving that new member that overview can allow them to feel empowered. Talk a little bit about, you know, previous successes and what you've seen from the Fatality Review, so that when they do sign up, they know that this is not just a meeting that they come to. This is really continuing the work even after that committee. And so just kind of talking about that overall purpose is really important. It's important for the individuals, and when you're looking at these individuals, that you're looking for people to be open, honest, and cooperative with each other. I believe that is actually how we see actionable change take place. We talked about not making sure that we're individualized, blaming anyone, but making sure that we have people that are honest about the approach or their agency, that maybe they did things a little bit differently or should change the way they approach it, being honest with that. And then my last point on this slide, this topic of discussion is a topic of discussion that a new potential member will bring up a lot. I have worked with a lot of different communities who are doing this work, and they get the same pushback, and it's the agency saying, what can I share, and where is it going to go when I do share it? And so these are people saying that I don't want to be a part of it because I don't know that I can share this information. I'm sharing details related to this decedent, and I don't feel comfortable doing that. And so a lot of times when this happens, there's our to kind of work around that. And so I've seen success through MOUs, data sharing agreements, as well as making sure that you're promoting that confidentiality, letting them know that everyone who's on board has signed a confidentiality agreement and they're barred from talking about any information that is not the information that they brought to the table. So if a different agency talks about the records that they have with the decedent, that other agency cannot leave with that information. You leave with what you came with. And so promoting that so that they feel a little bit more comfortable about sharing that information so that they know what it's being used for and where it's going can help you when it comes to that recruiting process. Sorry. And then again, the legislation, making sure that you actually put that in the hands of your potential partner if they have a problem with, information sharing, because the legislation clearly outlines what can be shared, and when you do share, it clearly talks about how you are protected through this legislation and this closed review, so that this information can be shared, which is going to increase the amount of information you have related to the decedent and get a better idea of their experiences. But that is all I have. I went a little bit longer than I thought I was going to, but I just want to say I appreciate you guys, and I think we can now open the floor for a couple questions. I think we have a little bit of time if anyone has any questions or comments or just wants to talk about how they do things.